Dry eye is a surprisingly common condition, affecting up to a third of the population. There are over 30 million sufferers in Europe, and this figure grows 2% every year, and yet it remains an underdiagnosed and undertreated condition. Dry eye can have many different causes, which may act through a common pathway. One form of dry eye may even exacerbate another. Causative factors include a range of environmental factors, chronic illnesses, side effects of medicines, hormonal changes, and aging, with dry eye being particularly prevalent in women of postmenopausal age. In many cases, there is no one single identifiable cause. The typical symptoms of dry eye include itching, irritation, blurred vision, sensitivity to light, foreign body sensation, and excessive tearing. Not surprisingly, dry eye can have a significant impact on a patient's daily activities and quality of life. In fact, in one utility assessment of patients with dry eye disease, the impact of severe dry eye was rated by sufferers as being similar to that reported for hospital dialysis and severe angina. And in some cases, left untreated, chronic dry eye can progress to cause visual impairment and scarring of the eye's surface, as well as an increased risk of eye infection. So why are tears so important? Healthy eyes are always covered by a thin layer of tear film, made of a mix of water, proteins, fats, mucus, and infection-fighting cells. Tears serve several important functions. They lubricate the eyes, keeping them clean and free of dust. They protect against infection, and they also aid sight by helping to stabilize vision. Tears are produced and regulated by the lacrimal functional unit, which is made up of these different parts. The lacrimal gland produces a liquid substance that makes up the majority of tears. The meibomian gland produces a fatty liquid that makes up the outer layer of the tear film that holds it in place. Eyelids spread tears across the surface of the eye by blinking. The cornea also produces some of the liquid that makes up tears. And the tear ducts allow tears to run down into the nasal passages. If any part of the lacrimal functional unit is affected, the whole system can break down. This can result in one or possibly both of the following outcomes. Not enough tears are produced. Tears evaporate faster than they can be replaced. Either outcome can result in dry eye. If the eyes are no longer adequately protected by tear film, the immune system tries to compensate by sending infection-fighting cells to the eye. These cells cause inflammation of the eye associated with more serious cases of dry eye. So how is dry eye diagnosed and treated? Diagnosis is based on multiple assessments, including patient history, physical examination, and diagnostic tests, such as tear film breakup time and the Schirmer test, which uses filter paper to assess quantity of tears. The first step in managing the disease is to identify and treat any underlying condition. Regardless of the cause, the mainstay of treatment is the over-the-counter artificial tear substitutes in the form of eye drops, such as Allergan's Optive. Artificial tears are typically buffered solutions containing electrolytes, surfactants, preservatives, and a viscosity agent intended to make the benefit of the drops last longer. So, what does Optive offer dry eye sufferers? The unique OsmoMax technology of Optive lubricant eye drops and Optive sensitive preservative-free lubricant eye drops relieves the symptoms of dry eye in two ways: by providing a long-lasting lubricating and hydrating protective shield on the surface of the eye with carboxymethylcellulose, by working below the tear film to provide osmoprotection to the cornea with the compatible solutes glycerin, L-carnitine, and erythritol. Furthermore, Optive is preserved with Purite, a preservative which is not only gentle on the ocular surface, but ultimately dissolves after use into natural tear components. Importantly, the superiority of Optive's OsmoMax technology has been shown in clinical trials against both Alcon Novartis's Systane and Ursa Pharma's Hylecomod eye drops. Moreover, Allergan is superbly placed in the increasingly competitive tears market, with further innovations in the dry eye pipeline, notably the potential launch of an emulsion form of Optive and, excitingly, the launch of the first-ever prescription-only medicine for dry eye, the anti-inflammatory product Restasis, set for 2013. Beyond tears, there is also the potential for Allergan to capitalise on its strong ophthalmology heritage by entering other ocular surface disease segments. With that, it's time to hand back to the Nitrogen team with you today. Thank you for watching.